The gentleman from Charlottesville, Mr. Toscano.
Speaking to the substitute.
Gentleman has the floor.
Thank you. Thank you, Mr. Speaker. Ladies and gentlemen in the House, Governor's budget is a better budget because it finds a way to bring our Virginia tax dollars back to the Commonwealth to be used to help people in need and to help the communities who are served by so many of our rural hospitals. The governor's budget puts everything in very stark detail. We've been arguing since the beginning of session that if we did something to close the coverage gap, we would be able to bring money into Virginia, we would be able to save money in the budget, and we would be able to reappropriate that money for other purposes. Now, there'll be a number of talks in a few minutes about how those monies are reappropriated for other purposes. But for now, let's focus a little bit about the Medicaid part of this and how it works. The governor has put this in elegant simplicity. This is no longer Marketplace Virginia, although there might be some elements to that. The reason for that is that several members on the other side of the aisle have expressed concerns about Marketplace Virginia and how it would work. I don't know how many times I heard that all it was an outline without a firm plan, how it would work. So the governor made it simple. This is pure and simple Medicaid expansion. Very simple, based on what we have now and adding folks to the process. We've heard concerns about what would happen in the long term. Would we have money to fund this out in the off years? So the governor made it simple. He created a pilot, a 2-year pilot that sunsets after 2 years. In other words, we would have to take an action to keep it going. There were concerns that we might not be able to get the kind of waivers that we need from the federal government to allow a 2-year pilot to occur. So what did the governor do? Well, he made it simple. He got us a letter from CMS that said that we, in fact, could do that. Many people were concerned that we wouldn't have money in the off years to pay for it. So what did the governor do? Well, he made it very simple. He took the bill that we passed last year. Actually, it was an initiative that was passed in the budget that created Merck, that established the Health Innovation Reform Fund, and he put $100 million in that fund. And any good business person who knows how to compound interest would know exactly how much $100 million kicks off in revenue and how that fund grows over time. So in the out years, if there were any concerns that we wouldn't have the money, this down payment helps us get there. A number of members were concerned that we ought to reform first before we do anything else. Both Governor McAuliffe and Governor McDonnell took that argument away because we've already adopted a whole series of reforms, and all of us have adopted the principle of booking the savings for those reforms. $230 million in the budget in savings. We've approved it. House Appropriations approved it. Those are real reforms. And secondly, the people who would be coming in under the expansion are the very people who reform targets. Most of the reform has to do with the managed care and bringing more people into managed care so you can make sure that it's efficiently done. The people coming in under the expansion are not the costliest. They're not the long-term care folks. They're not the elderly, the disabled. They're the easiest persons to do under managed care. And finally, members said, where's the beef? Where's the savings? And in elegant simplicity, the governor has shown us $225 million in savings brought into this budget to be used. Mr. Speaker, ladies and gentlemen of the House, Since the beginning of session, we've tried to argue the facts. And I think the facts are really uncontroverted. The rural hospitals have told us they're scared to death about what's happening out there and they need help. We put the reforms in place. We know we're leaving $5 million a day on the table. Those are facts that are uncontroverted. Now, we have had opinions come back at us, but they are opinions. Mr. Speaker, this is about Medicaid, but this is about much more than Medicaid. It's about millions of dollars that can come back to help people in Virginia. That's why this budget is a better budget, and that's why we think you should support it. Thank you, Mr. Speaker.